Hello. Yeah. So I hope you can see my screen. So let me start with the talk today. So as you all know that, as we all know that endocrine system is the most prevalent system in human and in animals. There are a lot of organs that are controlling uh, this endocrine system that are involved in, such as pituitary gland, parathyroid gland, ovaries, adrenal glands, as you can see. Similar to animals, there are the same kind of endocrine organs can be found in them. And as of today's talk, we are focused mostly on the thyroid gland. The thyroid gland, you can see in our pet animals are mostly dogs and cats, is located in the neck region. And this gland is the thyroid gland is one of the largest endocrine gland in the body. As I mentioned, it is located in the neck region of the organism, and the shape of the gland is usually a butterfly, a shape with the two lobes which are connected by the islets as a bridge. And as we can see the dissection of this gland, the anatomy is typical to the human thyroid gland, which has follicular cells. These follicular cells composed of sequamous shaped cells that are actually responsible for the production of thyroid hormones. And these follicular cells are covering another kind of lumen kind of area, which is known as colloid. Outside so this colloid is actually the secretion, like a savior bags of the thyroid, secreted thyroid glands from the follicular cells. Outside the follicular cells, you can see there are small cells which are known as parafollicular cells. These cells are also are presented there to support the production of another hormone which is related to the calcium regulation in the body. Other than that, the cells have a large supply of blood capillaries that can help for the transportation of thyroid hormones in the body of the animal. So the thyroid gland secretes mostly three types of hormones. These hormones are actually regulating many functions of the body. So the first hormone, as we know, is thyroxine, which is known as T4 in common language, have 4 iodine atoms in the structure. Next is the triiodothyronine, which is having 3 iodine atoms in its structure and commonly known as T3. And as I mentioned, the third hormone is the calcitonin, which is regulating the calcium, production and also the use of calcium in the animal and also as in humans. So out of these 3 hormones, T4 hormone is the most abundant circulating in the blood. However, this T hormone is present in an inactive form. So when it is converted into T3, that is the most potent hormone that can be used as a regulatory hormone in the body. Talking about the synthesis of these hormones, I think I hope I can make you understand through the diagram presented here. You can see that in the endoplasmic reticulum, the thyroglobulin is actually secreted, and then it is transferred in the follicular cells towards the colloid. So from here, at the same time, from the bloodstream through the I support the channel, the iodide atom and ions enter into the follicular cells. After that, they are transferred into the colloidal cell also, where they get oxidized to become iodine. The exocytosis of the produced thyroglobulin also do a chemical reaction where it combines with the iodine atoms to make these pre-thyroid hormones in the colloidal cells. After that, after the conjugation step, they can enter into the follicular cells again through endocytosis, where a number of proteosis enzymes act on them to cleavage the sites and become T3 and T4, which through unknown mechanism again enters into the bloodstream. So this is a very simple way to explain how these T3 and T4 hormones are produced inside the thyroid glands and then secreted inside the into the blood vessels to reach all the organs in the body. So as I have mentioned before, that thyroid gland is regulating many functions in the body, not just the main function, which is the growth, as a combination with the growth hormone, controlling the growth of the body. It also regulates heart rate, body temperature, and also the flexibility of the muscles, liver functioning, your menstruation cycles in the female, and other metabolic activities are also controlled by thyroid hormones. In the fetal or in the kids, this hormone is very important for the brain development and also the weight management. Related to that, I would like to share that the mechanism action of thyroid gland is actually controlled by the negative feedback of thyroid hormones. So this is the hypothalamus pituitary thyroid gland axis, which actually can show you the overall picture, how the regulation of thyroid hormone production is happening. So the core step is started at the hypothalamus, where the TRH, which is the thyrotropin releasing hormone, reach the anterior pituitary gland, where it stimulates the cells to secrete thyroid stimulating hormone. TSH actually then travels to the thyroid gland from bloodstream, where it activates the thyroid gland to start the mechanism for the production of T4 and T3. Once there is enough or normal levels of T3 and T4 reached into the blood, they can have a negative feedback onto the pituitary gland as well as to the thyroid gland, as well as on the hypothalamus gland, and which can stop the production of TRH and TSH, and then the production of T3 and T4 are actually get regulated. So any disturbance in this axis can lead to the malfunctioning of the thyroid gland and also the irregular levels of T3 and T4, which leads to many disorders in an organism or in animals as well. So talking about one of the disorder which happens because of the different levels of T3 and T4 is hypothyroidism. As the name suggests, hypo means the deficiency of something. So in this case, in this disorder, the thyroid hormone is actually deficient in the bloodstream, which can be because of many factors, but the main common factor is that the secretion of the thyroid hormone is happening very less, which results in the decreased metabolic rates. So this disorder is actually very common in dogs. This is one of the main problem happens in the middle-aged dogs. The clinical signs of this hypothyroidism can be lethargy, weight gain, obesity, hair coat change, And further, if we go, we can see that there would be a low serum thyroid hormone concentration. So if you observe these things in your dog, you should suspect that the dog may have or developing hypothyroidism. Going into more details, the classification of, the classification of hypothyroidism can be as primary, where the disease is located at itself in the thyroid gland, or it can be secondary, which is responsible because of the TSH secretion, decreased in the TSH secretion, or it can be ternary, where TRH deficiency can lead to the irregularity in the production of T4 and T3, or it can be congenital hypothyroidism. Let me explain you one by one how this is affecting. So primary hypothyroidism is started first either because of the lymphocytic thyroidist. This is the autoimmune issue related to the thyroid gland, where the diffusion of our immune cells, such as plasma, lymphocytes, and our macrophages goes into the thyroid gland, and it affects the functioning by destroying the follicular cells. Or it can be idiopathic atrophy, where we can see the reduction in the thyroid follicles, and they are replaced by the adipose tissue within the gland. So, as I mentioned, that the issue of the primary thyroid can be within the thyroid gland itself, which leads to the less production of T4 as well as T3. This can also be because of the neoplastic destruction, because of many reasons, maybe an accident or something can happen to the thyroid gland, or because of the iodine deficiency in the diet. Next can be because of the formation of the goiter in the animal, or iotropic things, such as if there is a surgery in the neck area, which might have affect the thyroid gland, or there is some medication, which is anti-thyroid medication, could be sulfonamides medications, usually affecting the thyroid gland. Next is because of the radioactive iodine. Some of the dogs or organism needs cancer treatments. So sometimes there are some radioactive elements which can make iodine radioactive, and also can lead to the thyroid gland issues or destruction in the thyroid gland cells that may lead to the less production of T3 and T4. Next is the secondary hypothyroidism. In this, as I mentioned, this is because of the deficiency of or the less presence of TSH. So the issue can be related to the pituitary gland. So either in the pituitary gland, there can be a cyst or hypoplasmia, or because of the destruction of pituitary gland, because of certain reasons in the body. There can be a production of TSS cell, but these TSH hormones can have defective molecules, like they are not folded well. That's why the hormone is inactive to activate further the thyroid cells. Or the TSH follicular cells, the receptors are not working well. So that's the reason that the hormone is also not transferred well into the cells. Or there can be reasons of drug therapy or radiation therapy, as I mentioned before, can also happen to the pituitary gland, similar to the thyroid gland, which can lead to the secondary reasons of hypothyroidism. Next are the ternary reasons, which are related to the hypothalamus malfunctioning, and also due to that TRH is deficiently produced into the bloodstream, and further affecting the steps of the thyroid gland, the thyroid hormone production. So it can also be congenital hypothalamic malformation or acquired in which acquired in the sense that it can be destruction of the hypothalamus or abscesses or a hemorrhage or some inflammation in the brain region, which can lead to the destruction of hypothalamus functioning. Or the TRH molecule, as I mentioned, is produced, but it's defective. Or also the receptors which are receiving the TRH are not functioning well. So that's why the signaling is not right to further do the activation of pituitary gland and later thyroid gland and the production of thyroid hormones. The reasons can also be congenital. As I mentioned, the congenital reasons can be thyroid gland dysgenesis, or in which the thyroid gland, there can be a surgery or something which can lead to the malfunctioning of the thyroid gland, or dysharmogenesis, in which the thyroid gland is actually not producing the hormone well, which can also lead to the high cholesterol issues in the body. Or it can be iodine deficiency in the diet. Not to mention that this can also be passed by the mother to the fetal, in which maternal antibodies, or if mother is taking any medication, that can also affect the development of the thyroid gland in the fetal. So we have to make sure that that this development of the hypothyroidism cannot be just through one organism. It can transfer to parents also to the kid, to the fetus. Yes. Next, as you know that regarding to the dogs, this disorder is mainly have seen or occurring in the dog with age 4 to 10, and also mid to large size dogs. In the small dogs or toy-sized dogs, this disorder is not very common. Compared to the population of the males and the females, females are less prone to hypothyroidism. However, the sprayed females can have a high risk of developing this disorder. Regarding the breeds, as you know, the mid to large breeds, which are such as Golden Retriever, Doberman, Labrador, and other breeds I have mentioned on the slide, are actually more commonly seen to have developing hypothyroidism. So talking about the clinical signs in such dogs, there's a research which have been done on 162 adult dogs with hypothyroidism, in which the skin issues have seen the most percentage occurring in the dog. Next is the growth or the metabolic rate in the body, where you can see the dogs are overweight, or either they feel lethargic or weakness. Weakness and neurological disorders have also been seen to be in some of the dogs. Other than that, cardiovascular issues have also been noticed in other dogs. So you can see overall, these clinical signs are the most common one which are found. However, the dermatology or the clinical signs related to the metabolic rate of the body are the most common ones in the dog. So if you feel that your dog is getting obese, however, the diet is good, so you need to really go for the diagnosis and consider or suspect that dog may have some thyroid issues. So you can see I have put some examples from previous studies. There's the 8-year-old retriever dog with hypothyroidism, which have a poor hair coat and lethargic appearance, as you can see in his eyes, and also have a very, very commonly seen another feature is a rat tail. Yeah, the hairs have gone, so the tail appears like a rat. So going into the more detail, you can see the clinical signs are mental dullness, which I already mentioned, lethargic, exercise intolerance, Skin issues can be dryness, excessive shedding of the hairs, or retarded growth of the hairs, or alopecia. In females, it can be reproductive issues with the failure of the cycles, or maternal cycles, or infertility, or neurological disorders, some nerve paralysis or other kind of paralysis happening in an organism. This is the case of the congenital hypothyroidism, in which you can see the dog is actually is only 8 months. However, the growth of the dog is not very good, is short, and also compared to the normal dog of the similar age, you can see it looks more dull and not very active. So this is the case of the congenital hypothyroidism, which can occur in juveniles. Next is also another case of congenital hypothyroidism, which is mostly because of the goiter formation. And this is only in the 5 weeks old puppy. So this puppy also have shown like bad hair coat or dry hairs and thick skin, and have a lethargic appearance, and also the development of goiter in his neck area. So as I said, that if you feel that these kind of symptoms are occurring in the dog, you may suspect that the dog may have some thyroid issue, and especially hypothyroidism, and we have to go for the diagnosis for the thyroid issue. So there are many theories or things. So there are many theories that are actually there, like which test or which biomarker we should be focused on to test for the hypothyroidism. So in a very simple way, I would like to tell you that in looking at the mechanism of the thyroid hormones, we know that in the bloodstream, as I mentioned, that T4 is present in an inactive form, which is known as free T4, which then goes into certain cells, such as liver cells, muscle cells, where it gets converted into T3. This T3 hormone is actually the active hormone, which is responsible for the regulation of different mechanisms in the body. So considering the T4 is more potent, that thyroid hormone is more logical to measure T3. However, serum T4 concentration in conjugation with the serum TSH concentration are currently recommended, because T3 can only be converted into liver cells and muscle cells. So if thyroid hormone is still functioning not good, the T3 hormone can still be present in the blood. That's why T3 is not recommended to be measured as or measure only for the diagnosis of hypothyroidism. So there are many tests which are there for the thyroid gland functional tests, such as serum concentration of total T4, free T4, or free T3, and also reversible T3, and endogenous TSH levels can be measured in the serum. Other than that, the other therapies are, the diagnostics therapies are TSH stimulating tests or TRH stimulating tests. Going into further more advanced tests, which are more expensive, are the antibiotic tests for the TG auto antibodies, T3 auto antibodies, and T4 auto antibodies. But in the most clinical clinics, the serum concentration measurements of thyroid hormones are the most common ones. Let me give you some idea of how these tests are working. So first, we look at the total T4 levels measurements. So in the normal situation, the cells can be seen. The cells can be seen to have a normal levels of T4 levels up to 3.5 microgram per dl. However, in case of hypothyroidism, the T4 levels goes down. Also, there are some issues which are non-thyroidical issues happening in the body, but still the T4 level will be seen higher in such cases. So the tests which are helping in the diagnosis are the radioimmunoassays or chemiluminescence immunoassays or ELISA tests. So all these tests can help you to measure T4 concentrations into the blood. And if you found that the T4 levels are low, then you can suspect the dog may have a hypothyroidism issue. Getting into the next step is the test for free T4 levels into the blood. So the baseline for this is around 0.5 to 0.8 nanogram per DL. And the lab tests which can help are the MED, which is a modified equilibrium dialysis, analog RIA, and analog chemiluminescence assay. All the tests can also help you to measure free T4 levels into the blood serum. So as you can see in this case, the normal case, the free T4 levels could be here, but when there is a case of hypothyroidism, the level of free T4 is also low. Comparing it with the case of non-thyroidical issues, the T4 levels free T4 levels are very similar to the normal dog. Next is the TSH level concentration calculations. So hypothyroid dogs might have serum levels of TSH concentration, which you can feel that they are actually around the reference range. As in this example, you can see from the previous study that only one dog is showing you the low levels of TSH and one dog is actually showing the high level of TSH. And most of the dogs, by the period of time, they are showing the similar levels of TSH in the blood. So as I have mentioned that the levels of TSH concentration in the serum can be very near to the reference range, we need to really make sure whether the dog is actually having hypothyroidism issue or it is having any other thyroidical issue which is not related to thyroid. So the chemical tests which are helping are chemiluminescent TSH assays and also some radiometric and ELISA methods which are present in the market to measure the TSH levels. Usually the TSH levels should be higher, but as I say that there are certain cases where erythroid-thyroiditis can also be responsible for the high levels of TSH or the normal range of TSH in the blood serum. Next test is the TSH stimulating test. So this test is actually very effective and to know whether to differentiate between the non-thyroidical issues or the thyroidical issues. So you can see in this test and TSH is introduced into the bloodstream of the organism, and then the level of T4 is actually calculated. So the artificial or recombinant TSH is introduced into the healthy dog, and then after 6 hours, the levels of T4 is calculated. So you can see that if there is in the healthy dog, the levels of TSH both after and before are same. There is no change. However, in a hypothyroidical dog, the levels of T4 also doesn't change when TSH is present. So that clearly shows that the case is of hypothyroidism rather than some non-thyroidical issues. Last but not the least, you can, the clinics can also do some therapeutical trials in which thyroid hormone supplements can be given to the dog with the dosage depends on the weight of the dog. So as I mentioned here, it can be 20 mcg per kg of the dog, and the supplement can be given once or twice. And based on the response rate, we can actually taper or withdraw the therapy and see whether the clinical signs are returning or not. If there is no response to the treatment, we need to further see whether the therapeutical trial we are doing is actually doing correctly or not. But this case is mostly useful in the initial stage of thyroidism. If the dog is already at the secondary or tertiary stage, other tests are more relevant. In our company, we are working on a device we have named it as V-Scanner Reader. This device is capable of recording T4 and TSH levels. Other than these biomarkers, it can also detect other biomarkers and other infectious disease such as parvovirus, FIV, anaplasma, and much more. So the device is under clinical trials now, and soon we are going to launch this device. So I hope that BioGuard can help in the diagnosis of hypothyroidism in near future. So if you are interested to know more about this device and also the other details related to this device, please contact us on our email address mentioned here, or you can scan the QR code and send your messages to us on Facebook and LinkedIn for faster response. Let's go into the factors which can affect hypothyroidism diagnosis. So the very common factors which can affect your diagnosis can be age, the body size of the dog, the breed, or the athletic training the dog is taking, or also the gender or the reproductive age in case of female dogs. As I would like to mention the most common features of normal and other stages of the dog in hypothyroidism. So in the normal dog, T4, free T4 and TSH level should be normal, right? However, in case of primary or onset of the disease, the T4 levels will go low, as the free T4 levels will also go low. However, the TSH levels can be high or it can be normal also. Further, if the disease proceeds to the pituitary gland issues, the T4 level will still be low and free T4 level will be low and TSH levels will also be low, as the secondary things are related to the TSH levels. Comparing it with the non-thyroidical issues such as erythroid sickness in the dog, T4 levels are still seen low. Free T4 levels will be low. However, the TSH levels will be high or normal or low. Depends on the state, on the condition of the dog or the functioning of its body. So on the basis of this, you can know that which diagnosed test initially you need to pick up to further do the screening or to correctly diagnose the test, whether it's related to thyroidism or some non-thyroidical issues. So this is the example I have shown you from previous study, in which you can see that first is the T4 levels in different stages of the case of hypothyroidism. So the first is the T4 levels in the first stage, in the mild stage. You can see the levels are here at certain number, and then by the course of time, it gets lower and lower when it becomes moderate to severe hypothyroidism. Also, free T4 levels will also keep going down. However, the TSH levels can be seen will not change much in case of hypothyroidism case. And this case, I think, is mostly related to the primary hypothyroidism. As I mentioned, the secondary hypothyroidism, the TSH levels will also alter. Next is the administration of certain drugs. Oh, I'm sorry. Certain drugs that you are actually taking or the dog is taking, which can also affect the functioning of thyroid gland. So you can see certain drugs such as glucocorticoids or phenyl barbital, sulfoamides, and also some the chlomioperamines can affect the functioning of thyroid gland. So glucocorticoids can suppress total T4 levels and also sometimes free T4 levels concentrations in the dog. Phenobarbital can cause decrease in the total T4 levels and mildly can increase TSH levels. Going further to the sulfoamides can induce primary hypothyroidism and also with clinical signs very similar to the very similar that can affect that very similar to the hypothyroidism or functioning and can also affect the functioning of the thyroid test. So we need to really make sure whether the dog is administered with some other external medications that can also influencing the thyroid gland or the diagnosing tests we are doing for the screening of hypothyroidism. So this is all about the diagnosis. How about the treatment? So the treatment in the dog is actually very simple. As in case of humans, we are using LT4. I think many of the patients or the relatives or the members of the family of the patient who have thyroid issues know this drug very well. Similarly, in dogs, this synthetic levothyroxine, which is also known as LT4, is given to the dogs in certain amount. So the initial dose should be 0.2 mg per kg, depends on the weight of the dog. And it is administered twice a day and empty stomach also. So based on this drug therapy, we can actually see that the dog can have very good improvement in his coat, in things like hair coat and other things. And also can manage the body weight in 1 to 2 months of the therapy. And then we can slowly taper or slow down the doses to check the T4 levels in the dog so that we will know whether the therapy is actually helping or not. So we can check if the evaluation of the clinical responses along with the 4 to 6 hours of the post-pill serum. So serum T4 levels can be measured, and this can be done after 4 to 6 weeks of the treatment. You can do this small test to check the effects of this drug in the dog. So the key points or the take-home message which you have to remember related to the hypothyroidism is that hypothyroidism in dogs is the most common disease happening because of it's an endocrine disorder, and it can be natural as well as because of the external effects, as I mentioned in my presentation. So effects of the hypothyroidism is that your dog will get slowed down in its daily activity, which is the most common symptom have seen related to the lethargy, weight gain, and also hair coat and skin issues. So diagnosis, as you all know, that there are many diagnoses which are present in the market. And the most effective one, I've also mentioned in my previous slide, you can choose which is best based on the condition or the stage of the disease. Next is the treatment, which is the availability of LT4, which is a synthetic thyroid hormone replacement present in the market. And as this is a man-made artificial hormone, but the treatment is very effective, and also the treatment is lifelong. So you cannot actually think of total stopping to stop the treatment. You can taper the dose towards the response of your dog. However, we cannot stop this treatment. But this treatment is quite safe, and it will improve the quality life of your dog. So you don't need to worry about the treatment of hypothyroidism. However, you need to really make sure the initial stage of the dog. So let's not make the disease more severe so that the treatment of the hypothyroidism is quite effective. So thank you so much for listening to the today's talk. And if you have questions, please leave it in the comment section. And please, if you would like to contact us for any information of our products related to hypothyroidism diagnosis or our other series of the products, please follow us on Facebook and LinkedIn by scanning the QR code. Thank you so much, everyone.
Okay, thank you. So thank you, Dr. Susan. And I think there are already some questions in the Q&A
Section. Yes.
So you can answer the question now.
So the first question is that how long is course of treatment if I use thyroid hormone? So as I said, the thyroid hormone is a artificial hormone. It's not the real hormone. So the initial treatment can be given to 1 to 2 months. You will see the clinical signs that are improving in the dog. So based on the improvement of clinical signs, you can select the treatment, initial the dose of the drug, and then you can only taper the drug based on your another trials that you need to do by slowing down the treatment, but you cannot stop the course. The course will go lifelong. Yes. Next question is, why is hypothyroidism more common in dogs compared to hyperthyroidism? Oh, this is a very good question, actually, but I'm not sure why this is there. Maybe I need to check it further. But according to me, this is because of the hormonal levels issues in the dogs or in the cats, because in the cats, hyperthyroidism is more common. And in dogs, hypothyroidism is more common. But so far, I'm not sure why this is there. But however, I will keep checking the previous research and I will answer you soon. Will long-term use of LT4 can lead to hyperthyroidism? What will be the initial retesting for T4 and TSH? Okay, so the long-term use of LT4 usually have not seen lead to hyperthyroidism. However, the overdose can lead to. However, the overdose of hypothyroidism can lead to the case of hyperthyroidism in animals. It is seen mostly in case of cats. The cats which are having some treatment for thyroid issues have seen the development of hyperthyroidism, but actually they were not having hyperthyroidism initially. Yeah. And what are the what will be the interval retesting for T4 and TSH levels? So the interval is actually again based on the stage at which you are administering the drug. So if you are already, the dog is having for the long term, the dog is taking LT4, you can stop it in a daily basis, or you can do it on a weekly basis also. And then you test the levels of the hormones in the body. So the TSH levels actually not get affected by LT4, only the T4 levels you can examine. Yeah. Okay, next question is, what are the two main hormones secreted by thyroid gland? So the thyroid gland mainly secrete basically three hormones, but the most common are the T4, which is further converted into T3. This conversion can happen in thyroid gland, as well as it can happen in other organs, such as liver and muscles in the organism. Okay. Next question is hypothyroidism in dog is hereditary? So first part of the question, I would answer first. This issue can be hereditary in a way when the fetal is developing in the mother. So if the mother has some issues, as I mentioned, that she's taking some medication or some therapy, which can affect the development of thyroid issues in the fetal, and later when the fetal will become an organism, fully grown organism, it can have thyroid issues. Next question is, which gender of the dog is more susceptible of hypothyroidism? So the male dog is more susceptible rather than a female. However, paired females have a high risk of developing hypothyroidism. Okay, next question is, a new patient was brought to me and they were being tested for hypothyroidism for some years already. I want to make sure this is correct. So how long should I wait after the medication is stopped before I can run the test? So first, there should be a gradual withdrawal of the medication, and then this can be done over, like several weeks. And then after the medication is entirely stopped, you can wait around 8 weeks or longer to further check the issue. Yeah. Next question is, would you recommend supplements that will help in coping with the clinical signs while treating with hypothyroidism? If yes, what are your recommendations? Okay, so I cannot recommend you the brand of the supplements, but the supplements, as I mentioned, can be the drug also, the LT4, which can cope up the normal signs or the severe signs. But the brand you need to pick. The name of the drug is, as you all know, is LT4, which is a synthetic levothyroxine. But the brand you can choose. I think most of the brand which are producing or manufacturing LT4 are trustworthy. So according to your availability in your country or your region, you can pick the synthetic LT4. Yeah. If the case of hypothyroidism is primary, which is an abnormality of the thyroid gland, would that mean that would that mean the supplement of thyroid hormone need to be lifelong? So primary hypothyroidism is actually, you can diagnose it easily by checking the hormonal levels, T4, free T4, TSH levels. Once it's diagnosed correctly, then you can do the supplementation. We don't do the supplementation initially, or we can't decide it whether it has to go for lifelong. However, we need to further, in the stage of primary hypothyroidism, we need to make sure whether it's because of the thyroidical issue or non-thyroidical issues. If it's because of the thyroidical issues, then the supplements will helpful. However, yes, the supplement will go for lifelong, but the dosage can be controlled. Yeah. Next question is, if the cause of, is there any reason, explanation why spayed females are more prone of getting hypothyroidism? For this question, I will again, I still have to check what's exactly the reason, as I'm not sure why the gender why the specific gender or the presence of spayed female is most prone to get hypothyroidism. However, what I think that due to the effect of other hormonal imbalance in the body of the spayed female, this could be the reason that the functioning of thyroid gland is actually also affecting based on the thyroid hormonal issues of the other glands, like a growth hormone from the like estrogen or other thing in the females. Yes. Okay, next question is, in the case of hypothyroidism induced by overdose of LT4, as mentioned earlier, what should be done to reverse it? Okay, to reverse the case, you need to further check what's the level of hypothyroidism actually happening in the organism. If it's very severe, we need to start the treatment for hyperthyroidism instead of hypothyroidism. But we need to know that the thyroid is actually may have primary or the short notice. I mean, for the short duration, it can have hyperthyroidism. Then once the hyperthyroidism is curable, we again need to shift back to the hypothyroidism trials. But this is actually kind of a very long case study, which further needs clinical trials of that patient and correctly monitor the administration of both the drugs, whether it is given for the hyperthyroidism or it is given to the hypothyroidism. Should we prepare FT4? Should we prefer FT4 over T4 to diagnose hypothyroidism? Okay, so this is another very good question, that which test has to be chosen or preferred. So actually, FT4 should be chosen because FT4 levels are more present in the bloodstream, which can be converted into T3 also. So this is more active, can be like an inactive form, but can be active also. Total T4 levels can also be used, but it has to be combined with other diagnosing tests, such as TSH levels or free T3 levels, so that you can further confirm that whether the lower levels of T4 in the organism is correctly diagnosed or not. Next question is hyperthyroidism possible on newly spared bitches, especially if they are manifesting dermal issues like non-putictic alopecia, flaking, mild hyperpigmentation, etc. Yes, that's right. There can be a case of hypothyroidism in this case, since it's related to female, but still we still need to diagnose. You need to diagnose it, as I mentioned, the test, because as you already suspect based on the clinical science, you have mentioned, which are related to hypothyroidism. So this case needs diagnosis before starting any treatment to the patient. Yes. So I think there are not any further questions. So, and also we have crossed our time limit. So if you have further questions, as I mentioned, our email address and also you have our links. You can send your queries to us on Facebook, LinkedIn, and if you have already noted our email address before, I would really be happy to be in touch with you, and also to share our product information if you are doing diagnosis in your clinics in your country. So thank you very much, everybody, to join me tonight. I hope you have learned something new, or you have gained some, you have regained some new information into your knowledge regarding thyroid issues, specifically to hypothyroidism. So thank you very much. Thank you, everyone, and have a great day tomorrow, and good night. Bye-bye.
Okay, thank you, Dr. Susan, for the excellent presentation. And I hope you have a good learning night, and good night. And we'll see you next time in our next webinar.